Going through menopause isn't just one experience. It's a spectrum. Some women cruise through menopause without hardly even knowing they went through menopause. However, some essentially are suffering and need hormone therapy in obvious ways. Let's say you coast through menopause and you're just not hardly even thinking about it, and you're not having the hot flashes, the mood changes, the sleep changes, you just don't even notice. There are still benefits of bringing hormones back on board. We typically bring hormones around the menopause transition, but sometimes it's just not recognized. Typically we start hormones in the menopause transition whenever they are having troubling symptoms, but sometimes it's just not recognized. Sometimes we pick up symptoms that are signs of hormone depletion that the patient didn't feel subjectively. Osteoporosis, osteopenia, poor lipid profiles. And so a lot of times we will still bring on hormones in a woman that did not have subjectively a hard menopause transition just to get the cardiovascular improvements, the bone health, the joint health. Hormones can improve chronic dry eye. Hormones can help restore genital urinary health and prevent chronic urinary tract infections. The cardiovascular health, I see a lot of cardiovascular positives from estradiol, from improved vessel function to better lipid profiles. Estradiol can lower Lp(a), which is basically does not have another way to be controlled. In the ER, we almost never activated the cath lab for a woman who is still cycling. I never say never because medicine always has outliers and everything, but it is very unlikely for a woman who is still cycling and in good health to suffer a sudden heart attack. And I think that's largely from the estradiol production they have. Bones are super impacted by hormone replacement as well. Hormone replacement prevents bone loss and lowers fracture risk. Estrogen deficiency is also linked to what some call the musculoskeletal syndrome of menopause. Getting good estrogen levels back can help improve joint discomfort, and even a sign of going through menopause can be frozen shoulder, adhesive capsulitis. And so if you're getting symptoms of that, estrogen replacement can help. I had mentioned previously that hormone replacement can help with dry eye. There are estrogen and androgen receptors in the eyes. Menopause increases dry eye complaints a lot of times, and restoring hormones can help improve overall eye moisture and everything. It's not a guaranteed fix, but it's another area where hormones may impact a woman even if they feel subjectively fine. I've discussed previously that local vaginal estrogen can be life-changing. It helps reverse vaginal atrophy, improves comfort. It significantly lowers the risk of recurrent urinary tract infections, and that can be life-saving as those urinary tract infections can be difficult to treat with multi-resistant drug bacteria or just not needing to be on antibiotics all the time. Untreated urinary tract infection can turn into pyelonephritis, sepsis, and that can all be prevented by vaginal estrogen at the beginning, keeping the tissues healthy. Again, some women have gone through menopause without any abnormal symptoms at all and feel subjectively well, but then later on they start seeing the symptoms of bone loss, vaginal dryness, urinary changes, joint discomfort, and these are all valid reasons that we may start a woman on hormones even if you feel subjectively okay. We do use bioidentical estradiol, micronized progesterone. These seem to be much more safe than the synthetic progestins that were previously used, or even the conjugated equine estrogen. Bioidentical estradiol and micronized progesterone bind more readily to your receptors and don't seem to have the same adverse cancer risk, thrombotic risks, or anything compared with the synthetic hormones. We do use compounded hormones at times if patients have intolerances to fillers, dyes, or other inactive ingredients in the commercial products. We're just always trying to find a formulation that the patient tolerates well and can be used consistently. The bottom line is menopause care should be personalized. Whether you're just entering menopause or a decade past it, HRT can have benefits for bones, heart, joints, eyes, genital urinary health, all while improving quality of life for the next several decades.